同大家再講下最新嘅疫情同埋回答大家嘅提問。今次訪京嘅行程呢都係好豐富嘅，咁所以由星期三到星期五傍晚離開嘅時候呢，喺3日時間裏邊係獲安排我諗相信係同4至6個部委呢係會面商討，我提出咗中央可以點樣進一步支持香港經濟復甦嘅措施就喺會面嘅過程呢，當然都會同各位關嘅部委講下我哋香港最新嘅經濟情況啦，同埋係我哋點樣展望未來，尤其是融入國家發展大局，包括嚟緊嘅第14個五年計劃啦，同埋喺粵港澳大灣區
Plan, how we can integrate into the Greater Bay Area as well as in-depth cooperation with Shenzhen. As to when we can resume flow of people across the border without the 14-day quarantine, I'd like to say that that is very important to economic activities, to the provision of professional services, to visiting relatives, going to schools, etc. As I've said previously, technically, that is, the health code is ready. In terms of testing, I will give you more information shortly. I will talk about how we have managed to reduce the cost of testing. The most important thing is that Hong Kong's infection situation stays under control. If you want 0 confirmed cases for a period of time, we can see that it is difficult. But we can also see that we will be able to well manage the infection situation. From last week, I can describe the latest situation as similar to the previous week. In the past 7 days, there has been 6 local cases. 3 of them are with an unknown source. These 3 unknown cases may cause small clusters. There is a chance that it will draw the attention of our government as well as overseas governments about changes in our situation. It's been 10 months when we are affected by COVID. We can't engage in our normal activities. People develop fatigue. That's understanding. However, apart from social interaction, people still need to work. Last weekend, there has been relaxation of social distancing measures. We've seen some crowd gathering. People have let their guard down. People started to gather for hot pots and for meals, activities involving the taking off of masks. There is a risk, so I appeal to members of the public in order to enable resumption of normal social activities and in order to inject life back into our economy through resumption of economic activities, the public should support all social distancing measures. Unnecessary group gathering activities should be avoided. We need to work together. By working together, we will be able to keep the infection situation under control. And on this basis, we'll be able to try to get these activities back to normal. The measures that will expire on, Thursday midnight will be extended for another 7 days. Directions will be issued later. Now, I'd like to give you information about some further developments of items that I told you about last week. COVID situation has stabilized. We have conducted a review to identify areas to enhance our capabilities to handle possible spikes in number of cases. There is testing, there is tracing. Last week, I have told you about quarantine facilities as well as isolation facilities in hospitals. We have an adequate supply, so we don't have to worry about that. In terms of testing, we have never let our guard down. That is in relation to health checks as well as testing for targeted groups. These initiatives have been ongoing, say, for example, those covering people working in homes as well as drivers. There are further measures. In order to better protect the teaching staff and students, the Education Bureau will, starting from next week, roll out measures covering people who work in the dormitory section of special schools, teaching staff, as well as school staff members of primary and secondary schools, further testing services to them. For people with mild symptoms, as Professor Yun said, this group should go to see a doctor as soon as possible, and they should get tested. In order to make it easier for them, there are altogether 46 general outpatient clinics that provide sample bottles distribution service. The testing service under Hospital Authority will be enhanced. People say that the distribution hours is rather limited. The Hospital Authority will extend the distribution service to Saturdays and Sundays. And for the 46 outpatient clinics, 8 of them will operate on Sundays and public holidays to distribute samples. There are 3 clinics that will be installed with vending machine that will give out sample bottles. Members of the public can obtain the testing kits from these vending machines. There is also the setting up of 4 community testing centers. They are in Quarry Bay Community Center. In Kowloon is Henry Leung in Yau Ma Tei. Sha Tin is Lake Yuen Community Center. And in Yuen Long, it's a community hall in Yuen Long East. We have conducted an open tender exercise. We have identified 4 private testing laboratories, each responsible for running 1 community testing center. These centers have a dual function. On one hand, they will provide testing services for targeted groups and testing services for clusters. The other function is testing service available when members of the public pay a fee. With travel bubbles, When you travel to other places, you still have to produce a negative testing result. Well, in the private sector, there is such service. I can tell you that now the fees is about $240 each time. Well, for the paid service, it includes the production of a report. In relation to testing for targeted groups or for clusters, it's not for the purpose of traveling or other purposes. So for that function, it doesn't cover the production of a report. Well, we have driven down the fees to $240 because of a number of reasons. First, the market falls. In the private sector, in January, the testing capacity was just about 1,000. Now, the number stands at 10,000 per day, at 100,000 per day. Well, that is thanks to the introduction of large testing laboratories. The second thing is government act. We have adopted the dual function tender exercise. The government will provide the service through testing centers. So these private labs don't have to find offices or operating locations themselves. In this way, they are able to reduce the cost. The private testing labs will send staff members to the testing centers to collect samples. It's not like under the universal program when we have to find staff members to help. The third reason why the cost can be reduced is because of an exemption. Before one gets a test, you don't have to have a referral of a doctor. Well, previously, you see that you will be charged over $1,000. That is with a doctor's consultation. The doctor's consultation is dispensed with under this service. This will provide convenience to people traveling. The contract will cover 3 months. Close to the expiry date, we will conduct a test to identify areas for improvement. If there is any need to provide more convenience or cheaper tests, of course the government will do it.
In terms of commuting, I'd like to talk about the stay-at-home mobile app or stay-home safe mobile app. It will be implemented by around the middle of the month. For the 4 community testing centers I mentioned, they will be in service from the middle of the month, and by that time, people can download the Stay Home Safe app and record their whereabouts, so in case of infections in the future, we can more easily trace the close contacts. Many premises intend to provide QR codes in order to complement the app. Most government premises were requested to include a QR code, and the number is dozens of thousands. For fitness centers, cinemas, etc., the government urges more premises to join the initiative. As for the details, the Food and Health Bureau would issue a press release to announce the details. Since Professor Sophia Chan will visit Beijing along with me, I believe no press conference will be convened this afternoon. If any of you have questions for Professor Chan, please do so. We now open up for questions. Please raise your hand and identify your organization before you speak.